What about the other one?
In Kenya, if you feel unwell, you can buy most medicines without a doctor's prescription. This includes antibiotics. The problem is, many self-prescribe without knowing enough about them.
Some want antibiotics for a common cold. Others want antibiotics for toothaches, when it is not really necessary.
And so, what do you tell these people when they come and ask for these antibiotics?
If someone comes and asks for an antibiotic, we interview them first. It's our duty as pharmacists also to make sure we educate the public. Once you dispense antibiotics, you need to explain to them that they should be taken the full course, should not stop taking them halfway, and the dose should not be repeated and it should not be given to someone else.
Some agree there are widespread misconceptions about the use of antibiotics.
When they believe in a certain antibiotics, they just go for it. They doesn't care what they are doing.
Most Kenyans, I don't know if it's because of fear of the doctors or the hospitals or because of the cost, prefer to just take over-the-counter drugs to prescribe for themselves medicine instead of actually getting checked and finding out the root cause of whatever it is they're ailing from.
This can lead to drug resistance, where bacteria adapt to become invulnerable to the antibiotics used to treat the infections they cause.
The misuse and overuse of antibiotics is a huge concern, because we do get populations of bacteria that can become resistant to antibiotics, and we would not, in the near future, we would not have enough antibiotics to take care of those resistant populations.
But antibiotic resistance isn't just a problem in Kenya. Superbug infections have already killed thousands of people around the world, and a recent survey by the World Health Organization revealed some shocking statistics. Almost 2/3 of some 10,000 people surveyed across 12 countries said they knew antibiotic resistance could affect them and their families, but didn't know what to do to prevent it. 64% believed antibiotics could treat colds and flu, and close to 1/3 thought they could stop taking antibiotics when they felt better. There are growing fears that the misuse of antibiotics is fueling the rise of superbugs, and that if more isn't done to educate people on how and when to use them, this could spark an irreversible global health crisis. The WHO has launched a campaign to mark the first World Antibiotics Awareness Week, which ends on November 22nd. The aim is to raise awareness and prevent the further spread of antibiotic resistance. Clementine Logan, CCTV, Nairobi, Kenya.